vitamin D may be the most effective chemotherapy you can have. It's been shown to reduce your risk of cancer. Having proper amounts of vitamin D has been shown to reduce your risk of all types of cancer up to 75%. And then using, they're doing studies now using vitamin D to treat some forms of cancer, using very, very high doses, upwards of 90, getting your blood levels upwards of 90 nanograms per milliliter to help treat the cancer. They're having some very good results. The word is kind of still out on that though, but I mean, from what we're seeing, it's working a lot better than any chemotherapy agent that we have. Plus, it doesn't make you deathly ill. It doesn't kill you. It doesn't do all these things to your body that are terrible for you. So definitely, if you do, I'm not saying that go out and if you get diagnosed with cancer, say, I'm just going to do the vitamin D thing. But definitely make sure that it's a part of your treatment, because it's going to be probably as important as anything else that you do. And most doctors now, especially when treating those kind of things, they should know about it. And if they don't know about it, it's just up to the doctor. Sun exposure, this is from a study done. It reduces the risk of breast cancer, colon cancer, prostate cancer, early stage lung cancer, Hodgkin's lymphoma, and myeloma. We have some maps here. This is a cancer mortality rate. This is of white females from 1974 to 1994. The red areas are higher density population of people dying of colon cancer. What can we see about this map? As we go north, where there's less sun, and sun's the biggest reason that we get vitamin D, we have a higher risk of cancer, higher risk of dying of that cancer. The maps don't lie like this. Another one, we see breast cancer. Same story. We see a little aberrant down here in Florida. Guess who these people probably are?
Snowbirds.
Yeah. Another chart here for ranges, things that they've determined to be helpful for these different types of cancers. Getting your levels upwards of 52 nanograms per milliliter, decrease your risk of all combined cancers 39 to 50%. Especially of the big ones, prostate cancer, breast cancer, colon cancer. Those are the ones that are the big killers, the ones that are real prevalent. Lung cancer, not so much, because people bring that upon themselves with smoking. A lot of times you've been smoking for so long that there's not much you can do about it. And that's why it only kind of works for early stage lung cancer. Autoimmune disease. A lot of autoimmune diseases out there, and they're becoming another thing that's really becoming very rampant, especially with chronic pain and chronic problems. People are very debilitated sometimes by these things. A couple of them: rheumatoid arthritis, lupus, fibromyalgia, which is a borderline one. They're really not sure what causes it yet, but a lot of doctors are starting to think that it's an autoimmune type thing that's going on that's causing this, along with some other things. Endometriosis is a form of autoimmune. A lot of women have problems with that, especially it's becoming another one that we didn't see it a long time ago. It's becoming more and more prevalent. And why? Scleroderma, multiple sclerosis, Crohn's, ulcerative colitis. The funny thing about a lot of these is they really don't exist closer to the equator. They don't have a lot. They just don't have. No one has it. Why is it? It's kind of a funny thing. A lot of we speculate that it's because of vitamin D. They get plenty of vitamin D down there. We get almost none. So we have a ton of these diseases. Yes.
Ken, on the cancer one, was that last one? Was that melanoma?
Myeloma.
Oh, what's the difference between that and melanoma?
Multiple myeloma is a different form of cancer. It's a
bone, like
it's a form of bone cancer.
Yeah.
Okay, but melanoma, you do get from the sun?
You will actually, and that's a funny one. You get that one from the UVA rays, but getting the proper amount of UVB rays will decrease your risk of melanoma as well, as long as you don't get sunburned. Once you get sunburned, that's when the skin changes start to happen, and then it increases your risk. If you can keep yourself from getting sunburned, the vitamin D that you get from the sun will actually decrease your risk. But that's a tough one that they've had problems studying, because how much is too much, and if people are getting sunburned, you got to kind of throw their results out, because that's one of the things that makes so. And there's some problems with them studying that, but they have found that it will, as long as you're not getting the harmful effect of the sun, that it will decrease And it also decreases, if you just get the UVB rays or the vitamin D, decrease the aging that the sun causes. The UVA rays cause that aging effect, and that's because those people kind of have damage from the sun, because they'll get sunburns and they'll stay in the sun too long, where you're looking for just 15 minutes a day out in the sun, where they'll spend all day out there, especially fair-skinned people.
So what you're saying is, if you're 15 minutes a day, you get the good UV rays?
15 minutes a day, and 15 minutes is about the time it takes, your body to burn, get that little pinkish. After that, you'll start to burn.
Then that's the bad rays.
Well, you're getting them both, no matter what.
Okay.
But in about 15 minutes, your body will get enough UVB rays to produce about 20,000 IUs if you're having full coverage of skin. If you're just doing face and arms, you'll get about 2,000 to 3,000 in about 15 minutes, which is what we about recommend. So even just doing face and arms, maybe legs, you'll get between 2,000 and 5,000, just from that, But as soon as if you're darker in skin, you're going to need more. If you're older, you're going to need more. But maybe you can get, a couple minutes in the sun and then pop 1,000 to keep it. But there's definitely a link, because the way we're made, we're supposed to get our vitamin D from the sun. That's the natural way to get it. That's why it's not, and I think that's why it's not in the food we eat, because it doesn't need to be there. Because we're not supposed to get it from food. We're supposed to get it from the sun. So that's why we're seeing a problem with that, especially with people coming up north. Autoimmune. Like I said, a lot of these diseases just don't exist at the equator. These diseases tend to affect women more than men, and the reason for this, women tend to have a lot more hormone fluctuation than men, a lot more hormone problems. So a lot of these things are regulated around hormonal issues. Vitamin D is a big one, regulating hormones and helping hormones to work better. It's possible genetically. Parents have autoimmune diseases, kids have autoimmune diseases too. And vitamin D has an effect on over 2,000 genes in the body. So it will have a positive effect on regulating 2,000 genes, helping those genes to make cells that work better, function better, to do the things that we need them to do. Autoimmune diseases, the problem we have with them is, if you're not familiar with how they function, our body will make antibodies to tissue in our body, and it will actually start to attack our own body. Usually we'll see it in joints. People with rheumatoid arthritis, their white blood cells will actually start to destroy their joint tissue. Why is that? They're not really sure. So the answer that they come up with is, we're going to suppress your immune system. We're going to turn off your immune system. What's that do? It makes you more prevalent to getting other types of sicknesses. Cold, flu, other types of viruses. So if we can just regulate your immune system, we get these things. A lot of times, vitamin D will help these things to work better, where they're not looking to attack your immune system or attack your body. And that's kind of like one of the messages we're trying to hit home with you. Vitamin D makes things work properly, makes things work right. So if you have a bunch of cells or a bunch of blood cells or white blood cells in your body that are attacking your own tissue, that's not right. There's something going on wrong with that. Vitamin D will help to regulate that so it doesn't occur. Regulate not only the strength of the immune system, but the function as well, right? So we bolster the immune system by producing those peptides, but it will also bolster the immune system by helping it to fight the right things, going after the right types of foreign bodies, not attacking our own body, our own tissue, which a lot of autoimmune diseases, that's the problem. A couple studies here. Vitamin D intake incidence of multiple sclerosis, upwards of 400 IUs, which we've kind of discussed already. That's almost nothing a day. That decreases your incidence of 41%, or inversely related to MS, down 41%. Imagine if these people were on higher doses to get their blood serum levels into the 60s and 70s, where they should be. We'd probably see a much stronger correlation. Another correlation we see as we move in latitude north, we're seeing a much higher prevalence of people with MS. 45 degrees north, we're seeing 200 in the 200s, whereas we're down lower, we're only we're seeing half to a quarter of that. Another chart here, MS rates.